Thank you very much for coming. First speaker I'll be introducing is Professor Hank Weiss. He has over 30 years of experience in the area of injury control, founding the state program in Wisconsin, and since 1992 in academia. He received his PhD in epidemiology from the University of Pittsburgh and has an undergraduate degree in environmental studies from the University of California. Dr. Weiss has authored over 50 peer-reviewed papers and has developed several websites. He was the chair of the APHA Injury Control and Emergency Health Services and president of the Society for Advancement of Violence and Injury Research. He's also received awards such as the Alex Kelter Visionary Award. His research has covered surveillance, violence, poisonings, bicycles, motorcycle, head injury, data linkage, injuries to pregnant women, and that is just a partial list. Currently, he is focused on the intersection of health, transport, safety, and sustainability. I'm honored to be working with him. Please welcome back Professor Hank Weiss.
Thank you, Amy. Very nice. The pressure to drive in New Zealand and many other countries around the world begins early, very early. Perhaps not quite as early as cleverly depicted in this Alfa Romeo ad, but the ad clearly tries to make us think that the love of driving is something that is innate, almost as if it were developed in the womb. Of course, Alfa Romeo is not the only car company that targets young people for their alluring products. Just last year, the world's largest automobile manufacturer received a fair amount of criticism for this ad, seemingly straight out of the 60s, depicting this poor university guy on a bike through the smug, condescending eyes of his sexy classmates. Stop pedaling and start driving, it proclaims, and pick up a discount while you're at it. Well, it didn't take long for a clever bicycle company and bloggers around the world to fight back, turning the GM slogan on its head. From the League of American Bicyclists, quote, "If you are a student looking to add tens of thousands of dollars of long-term debt, care little about the environment, and want to lump 2 tons of steel around campus while paying through the nose for insurance, gas, and parking, General Motors has a perfect deal for you. Bonus, it'll make you fat and unhealthy." I'm sure the campus facility peoples will love having to add thousands of extra car parking spaces on campus at $30,000 a pop. Who needs more buildings to learn in anyway? Let's fill campus with parking structures. And university presidents will have a little bit of explaining to do when it comes time to those end-of-year climate and greenhouse gas targets, end quote. Well, clearly, GM heard from a lot of upset cycling folks about these ads. And GM, to their credit, realized their mistake, apologized, and dropped the ads. But this episode clearly highlights in microcosm many of the issues that I and the speakers today will follow up talking about. As Thomas Huxley said a long time ago, it is the customary fate of new truths to begin as heresies and to end as superstitions. What I wish to introduce to you today is perhaps not quite so much a heretical new truth, but is, I would claim for teens, a new approach, and we term that adolescent mobility health. At its heart, it's really a very simple idea that we need to bridge the 3 currently siloed domains into one interrelated, coherent focus. Adolescent mobility health is simply the intersection of the current domains of transport safety, sustainable transport, and health for teens. It is through this merging that I think a powerful new meme can develop around transition teens. Those teens making the transition from reliance on their parents' choices, emerging from childhood limits and constraints, to making their own decisions on how to best move around their neighborhoods and their communities. Now, to be clear, I'm not the first to bring these domains together, far from it. The title of this talk itself borrows from Paul Tranter, who's with us today, and Warren's recent paper in the Journal of Transport Geography entitled Progressing Road Safety Through Deep Change in Transformational Leadership. And they themselves built their ideas on sustainable mobility, shown here from many other voices over the years, as I'm sure Paul, who speaks next, will acknowledge. But what is actually quite rare in both the academic research area and in practice is an age-specific focus on transition teens. Many have encouraged and written about healthy and sustainable mobility as a general need. Many have focused on young children, some on the population as a whole. But precious few have concentrated on the special opportunities and challenges on focusing on transition teens, and fewer still have considered the ramifications for the adolescent health domain within this context. That is the gap that the Adolescent Mobility Health Consortium, our new university-based activity, has been created to help both elucidate and fill. It is a fairly common assumption, I think, in today's society that teenagers want and will drive. And this is most evident, excuse me, when you look at young driver education programs and other related teen safety programs in New Zealand and much of the Western world, where there is almost no mention in such programs of the alternatives to driving. But I submit most of these programs are not in line with rapidly approaching energy and environmental constraints, are not in line with what many young people actually aspire to these days, and are not in line with the simple fact that in most developed countries, half or more of teens of full licensure age do not have a full driving license. At the AMC, our aim is to encourage, develop, and support research, interventions, and evaluations that facilitate voluntary adolescent transport modal shift away from motor vehicles to active and public transport, so that adolescents have the freedom to make their own healthy mobility choices, choices that perhaps we have not been able to make as we grew up. This symposium serves as the kickoff to that effort. But why youth especially? I think there are about a half a dozen or so good reasons for this special focus. From a transportation safety perspective, they have one of the largest crash injury risks of any age group, and we'll look at that in detail in a second. This has led to a tremendous amount of research and safety programs, but in many countries, these efforts have plateaued and remain firmly fixed within a narrow road safety perspective. Focusing on youth also provides an often very unique settings where peers, teachers, and parents can work together to play unique and important roles. Another reason is that adolescents are less likely to have physical barriers to increasing active transport than their older or younger counterparts. And they may be more sensitive to cost considerations due to limited means. Healthy mobility habits also learned at this age may be ingrained for life, making it a smarter investment where resources are limited. See, youth are at a stage where making many decisions about whether to learn to drive, how much and how far to drive, and whether to buy a car, not just whether to drive safely. Hence, they may have the stimulus at this important juncture to consider their choices, and thus may be more receptive to new ideas and information than older people more set in their ways. Lastly, today's youth represents the first generation who will likely live long enough to experience and fully accept the serious consequences of climate change. They will not have the luxury of denial of my generation, so they have a strong personal stake in effectively addressing one of its main contributors. Let's look at these three pillars of adolescent mobility health in a little more detail, starting with transport safety. For those in road safety, these kinds of graphs and numbers are not new. Youth are consistently a group at high risk, no matter how you slice the data. Here we look at total numbers of drivers in New Zealand involved in fatal crashes by age group, with young males standing out there on the left side of the graph. Here we look at fatal crashes in New Zealand by age per both distance-based measures, the bars, and license-based measures, the lines. Again, young males stand out. Finally, we look at the numbers of passenger deaths and see the horror in the numbers among the young, taking their deadly toll there as well. The road toll is not an exclusive problem of the young, but nowhere else does it do so much harm to those with so much more to live for. And if we look at recent trends of driver deaths, we see that despite the recognition of the problem of teenage crash injury for many years, little progress has been made. While most age groups in New Zealand showed declines from 1998 to 2007, the rate of youth fatal or serious driver injury per 100 million kilometers traveled has not improved at all. If the definition of insanity is to keep doing the same thing over and over and expect a different result, we must ask ourselves if the current approaches to making driving safety safer for young people is really the same thing to be doing. Don't get me wrong, there are ways to make progress. GDL laws brought the rates down in the late 80s in New Zealand and are working elsewhere. Well-enforced zero-tolerance alcohol laws have been shown to be effective. It may have had an effect in the 2011 lowered toll in New Zealand. But we should be looking for all the ways to make progress. But one of the most obvious, to encourage young people to drive less or not at all, has received very little attention. We do know that driving less saves lives. It's both a clearly logical and an observed phenomena seen across the OECD, the US, and Canada. Simply, the higher the average vehicle kilometers per capita, the more driving, the greater the rate of traffic deaths per population, a relationship that holds across many, many developed countries. And so the question must be asked, why don't transportation safety and health professionals develop, test, and implement large-scale interventions that encourage young people not to drive or to drive less? The second leg of the deep change approach addresses issues related to sustainable transport. Now, time does not allow me to go into all the environmental effects of driving and creating and living in a car culture, but they are considerable, widespread, and often externalized in terms of cost or ignored in terms of damage. While for years the road safety and health sector has been mostly oblivious to these external costs and adverse outcomes, other than death and injury, other scientists have been cataloging the myriad ills since the auto was first invented. It is long past time to ignore these other health, social, and environmental outcomes as someone else's problem. The one environmental issue I will focus on for a couple of minutes is greenhouse gas emissions. Transportation is a major contributor to greenhouse gas emissions. From the United States, we learned that from 1990 to 2009, transportation's total greenhouse gas emissions, nearly all of which were carbon dioxide, rose 17%. In 2009, transportation was responsible for 33%, one-third of total CO2 emissions, and about two-thirds of those were from passenger cars and light-duty trucks. Major additional transportation-related sources of greenhouse gas emissions are the result of the manufacturing of vehicles, construction of roadways, and other related infrastructure. And in fact, from a scientific point, it's worse than it appears. Because today's motor vehicles give off minimal amounts of sulfates and nitrates, both particulates that cool the climate, NASA has estimated that the road transport sector alone is and will remain the leading industrial sector driving climate change for the next 40 years in a business-as-usual scenario. Now, the overall impact of that, as many of you know, is that the planet is warming rapidly, not just with land, atmosphere, and ice heating, but with ocean heating as well, the entire planet. It would be simply foolish to believe that the energy imbalances caused by the greenhouse effect would not have a major impact on our planet. We are now at the stage where, according to the UK Royal Society, the possibility that unrestricted emissions of greenhouse gases would not do unimaginable harm to humanity has become vanishingly small. That's because we remain near the worst emissions case pathways. There's little prospect of global action anytime soon. Many impacts are coming faster than the models projected, and the overwhelming majority of the scientific literature of the past 5 years has been more dire than the 2007 IPCC report, which itself was more than enough motivation for the overwhelming majority of climate scientists and countries to call for urgent actions to reduce emissions. And the worst impacts would be largely irreversible for 1,000 years. According to the UK Royal Society, in such a 4-degree centigrade world, the limits for human adaptation are likely to be exceeded in many parts of the world, while the limits for adaptation for natural systems would be largely exceeded throughout the world. In summary, there's no doubt that the climate is changing. The evidence is overwhelming. Human activities are triggering what we are witnessing. Whoops. We are already seeing the social, economic, and environmental impacts of a changing climate. This is the critical decade. Decisions we make from now to 2020 will determine the severity of climate change our descendants, your children, will experience. Unless effective action is taken, the global climate may be so irreversibly altered that we will struggle to maintain our present way of life. We have a limited window in which to prevent unimaginable damage to the planet. Climate change, then, cannot be brushed aside as someone else's problem. It is packed with consequences for human health and welfare and must be faced up to from both the fossil fuel supply side and the demand side, which in today's context means fossil fuel-based transport. The question for us here today is this: is encouraging our young people to adopt the same behaviors and habits that have created a large part of our terrible climate change problem smart policy to continue? I believe the answer is no. Business as usual within a fossil fuel-based personal transport system is unacceptable and unfair to future generations. The third part of the new triad of adolescent mobility health is health itself. This shirt says, "This car runs on money and makes you fat, and this bike runs on fat and saves you money." The t-shirt is clever and funny, but the statistics are not. The relationship between adult obesity, and of course adults are grown-up children, and active transport is now starting to come out in studies around the world. Here we see in 14 OECD countries, Australia and North American countries, various relationships between the percent of travel by bicycle and walking and the percent of adults who are obese. The conclusion: societies with low rates of active transport trips have the highest rates of obesity. But while obesity and other ills related to inactivity get their deserved attention, a potential Pandora's box of other health problems have yet to receive the spotlight of much scientific scrutiny. Only until the last 10 years was there any decent research conducted that specifically aimed to determine whether the acquisition of driving, legal or otherwise, is an independent risk factor for substance use, sexually transmitted diseases, and other adverse youth behaviors. We've searched the literature and found just a handful of studies that have looked for such associations, yet they have all reported finding them. 2 for alcohol and other drugs, and 1 for sexually transmitted diseases. Termed non-traffic health risks of automobile use in a review by Weiss et al., this remains a very neglected area of research. I find it rather ironic that in a car-centric society like ours, where we acknowledge and worship so much about the impact of the automobile on our lives, devoting huge portions of our budgets, media, and entertainment to its glorification, that we spend so little time to understand its behavioral health effects on our lives and those of our youth. Am I suggesting that the Ministry of Transport be responsible for monitoring and preventing increased risk of sexually transmitted disease in car users? No, of course not. But I am suggesting that blind promotion of increased car use has consequences on health and on health beyond injury, just as it does beyond on the environment, and we all end up paying the price for that. Perhaps we need a new kind of professional to strive to become a mobility health expert and figure out ways to bring existing agencies together to form new entities to work on these cross-cutting but largely ignored issues. So this new paradigm, considering simultaneously the intersection of the domains of transport safety, sustainable transport, and health for teens. Are we ready for it in our car-dependent societies? I'm going to be an optimist, my wife would say, for a change, and to say we're ready to begin. If you look around and see only what is, it's easy to be pessimistic. Low rates of walking and biking to school, unacceptable levels of non-motorized infrastructure, increasing obesity rates, threat to governmental support for non-car-based travel and travel safety programs. It doesn't look good for those that espouse deep change. But I take heart in some interesting survey work in the US, and I've seen a few elsewhere, that suggests if we look instead at what people want to do, a totally different picture emerges. In a recently published survey by the Zipcar folks in the US, they reported that US millennials, defined as young people ages 18 to 34, increasingly want to embrace, increasingly over time, and increasingly over their older brethren, want to find alternatives to driving to reduce their time on the road. Now, finding out what people want is harder than finding out what they do, but it is only by asking these types of questions that we can garner support from the policymakers and the politicians whose job it is, after all, is to do the will of the people. Young people, it appears, will drive less if given reasonable and safe options. And for many people, reasonable options already exist if they would look and consider the full costs and benefits of the options, as we will hear from some of today's presenters. And if we find ways to succeed in accepting and implementing this new paradigm and succeed in achieving deep change by facilitating adolescent transport modal shift away from motor vehicles to active and public transport, we will have a host of gains to point to. These include reduced traffic congestion and delay for all road users. Per capita congestion delays are 30 to 50% lower in urban regions with high quality public transit than in otherwise comparable cities. Road and parking facility cost savings. People who live and work in areas with car alternatives tend to own fewer cars, make fewer trips, reducing parking rates. We gain from improved mobility for non-drivers and reduced chauffeuring burdens for drivers. People who for any reason choose not to or cannot drive tend to be disadvantaged if they live in an automobile-dependent community. Alternatives provide accessibility for non-drivers and so reduce the need for motorists to chauffeur non-driving family members and friends. We also gain from increased traffic safety. Per capita traffic safety fatality rates are substantially lower in communities with high-quality public transit and active transport. We also gain from improved public fitness and health, energy conservation and emission reductions, and increased productivity and development opportunities. These benefits percolate down to the individual level as well, a finding that offers insights into potential ways that intervention programs aimed at teens and parents might work. Now, there are many such leverage points. Cost is just one of them. There's also the workplace as an intervention point, peers, the school, the family, the community, the built environment, and concern about the environment. These are all good leverage points to base programs on. And this is what makes me so excited about adolescent mobility health. My public health training says that within various combinations of these leverage points are many different opportunities for successful interventions. But here I must be blunt and say we don't yet know from any firm evidence-based perspective what the right combinations are. There are just too few efforts that have gone on, and most of them have been rarely documented, well documented. The research base is simply not there or is very weak. Lots of methodologically sound research is badly needed to be done. Now, we can learn from others' failed attempt to impact on youth behavioral risks about what won't work. There's probably no silver bullet. There's no magic product. There's no magic slogan that's going to instantly change the status quo. Targeting general attitudes towards driving across all youth is probably unlikely to be effective. And simply providing youth with cold information about negative practices, trying to make them feel guilty, is unlikely to lead to substantial changes, and that's especially true among youth. But there are hints from programs that are aimed at adults as to what kind of things might work. These include the need for personal engagement at a one-to-one, single household level or a workplace level. The need to build in functional materials, materials that do things, such as public transport tickets, maps, timetables, smartphone apps, things that you can put into people's hands and minds that allow people to explore new travel options, plans, and make decisions. The support of local leaders, councils, senior company management, school boards, and of course parents. And whole of community involvement. Larger interventions appear to have better results, suggesting that individuals are supporting and reinforcing each other in these large-scale programs. And lastly, removing incentives and subsidies for car travel or rewarding green travel alternatives. We clearly must prepare now for a future which will undoubtedly include much higher fuel prices, carbon constraints, and the need to increase our physical activity levels. And for many, that will mean driving less. It simply makes sense to do these things now so that we and our societies are ready for the future. It is wiser to anticipate where the travel puck will be and invest accordingly in our youth and in our communities today to prepare for a better tomorrow. Now, encouraging desirable and healthy behavior change through fun, I think, is also a very promising route to explore, especially for young people. I'd like to finish my talk by showing you just a very short video that does that in a very fun and instructive way.